Dr. Vinny, how are you doing?
I'm good. Enjoying the summer and this beautiful day today.
We were both traveling. I know you just got back. How was the road?
Very good. Traffic as usual going to Rhode Island, but all in all, it was nice. Beautiful weather to travel. We got lucky.
After a rainy beginning of the year, beginning of summer, now we're enjoying it, and
Yeah.
hopefully the fall keeps going.
Looking to the fall, one of my favorite seasons.
Me too. I'm eager to talk to you about your podcast and your practice at New Jersey Total Health. Tell me a little bit about, the last 10 plus weeks of doing podcasts and what you've learned about doing that, how you feel about it, what you've done in the last several episodes. Give me a little download.
Well, first of all, I enjoy it. It's fun. I mean, I think you guys make it fun, especially in your studio. I think it's like super cool. I'm like a little kid there, but one of the main reasons I really enjoy the podcast is because not only does it help with my patients' questions, but for myself, it helps me question things in the way I present them and the words that I use and the tone and those different things. Because I think it all plays a part, And the more I talk about balance, the more I realize it's difficult, because everybody has a different set point, so to say. Everybody's balance comes from doing different things. And when you want to present it in a way where most people could benefit, you know, it's not easy because I am anyway, so individualized with so many things because everybody should get what they need. There's enough cookie cutter stuff, in my opinion, in the world. I think we get inundated on a daily basis with, things to make us who someone else wants us to be. And believe me, I'm totally against that. To me, total health is total freedom. And I mean that in every area and every aspect of your life. When you're free, there's nothing better than that. And I think when you're free, to me, free and freedom implies a flow and not just the intermittent flow, continuous flow. And I think that's what life's about. That ebb and flow and stop and go and just life, which is beautiful. I think on a whole, we concentrate more on the negative stuff, myself included. And that's why I become aware of it because, I've been trying to figure out when you say certain things to some people, they react a certain way. When you say something to someone else, they react a certain way. So, how does that come into a chiropractic office? Because once you set the tone for the visit and the treatment, the body responds, immediately. One, two, three. Especially when you're fortunate enough to have your hands on people, palpating and touching for spots where there's an imbalance, whether it's in tighter muscle or looser muscle, or a spasm or pain or tenderness. There's always some type of awareness, and I've been noticing more and more by the words I use and the things I say and how the people feel. They feel different on the table. So it's really pushing me towards the direction which I always try to incorporate, and more on the what's said and what we're talking about, and try to guide it in a focus, that's beneficial to the patient. Because no matter what I do, if a patient doesn't believe in themselves and their thoughts and beliefs aren't around health and wellness and balance, it doesn't matter what I do. I say this all the time. You give them just a temporary feel good kind of thing, and that's not what I'm looking for. I'm looking for a lifelong relationship where a person knows when they're out of balance, when they need to come in, when they don't need to come in, what they need to do for themselves. I mean, that to me, that's on the road to freedom. And that's what I look to do. Don't ever misunderstand me. I don't have a script. If I have to follow a script, I don't want to do it. It's a spontaneous thing that comes out when you interact with other people. When you're calm and prudent, and I don't mean that in a bragging kind of way, you're more methodical in what you say and what you do. It's no different than two good fighters in the ring. When they know what's going on, they know what they're doing. They're just not throwing hands and feet. They're doing it in a way what's most beneficial. And I think that comes with practice, right? Experience. You realize, what you're saying and what you're doing. But the flip side to that, and this is always my downside. I felt it's a downside in some ways because I was born in Newark. Most people look to screw you, especially in the produce business. So you're always on some kind of guard when someone says something or does something. And I think about that as a patient coming into me that doesn't really know me, that's been to someone else, maybe had a different experience. They usually come in a little guarded until they get to know you. And I like that. Let them have their doubts, and then we see if we're a fit. Like I always say, if we're not a fit, I really don't want to work with the person. They don't want to work with me. I don't want to take their money and waste both of our time. And that's how I've always practiced. And it serves me well. I'm happy what I'm doing. I love it. And now this podcast information I think is fun. It's always fun when someone for your whole life says, "Oh, I didn't know you knew that." I don't know. Yeah. Either did I. How do you like that?
Well, you've talked, as we started the podcast, a couple themes have come up. You've spoken about awareness, you've spoken about balance. When you have a new patient, they come in, how do you get them aware of awareness? How do you help them build awareness in how they feel and how treatments are helping them?
That's an interesting question. It's hard. It's hard to just come in and say, I'm gonna help them understand awareness. It's more of a guide. And when they show me something, then I say to them, that's a sign of awareness. There are the things I want you to become aware of. And then they start to understand, oh, it's not just about, watching where you're walking, in a crowded room or something like that. It's about an inner awareness that you get like, like a little tingle or whatever you feel. And I think when that comes to be, then the person understands you in a different way and you understand them in a different way. But is there any set protocol that I follow? No. It's basically impossible, especially for me.
Mm.
For me, once I start following something and thinking about something, it kind of throws me off, you know. It's just I'm not a B, C, D kind of guy. So I'm not saying there's anything wrong with that, but some things you got to do that. Let's be realistic. But most things in how to understand the patient better and how to gear their treatment to them, that takes a little bit of time usually.
I wanted to ask you about, looking forward, and the fall of this year is coming. It's 2025 and the fall is coming up soon. Here we are talking on Labor Day weekend and the summer's ending, but we've got 26 ahead of us as well. And, a lot of people are stressed. You see it out in the road, driving around, people driving like crazy and, finances seem to be tricky for a lot of people, getting trickier. How are your services and your treatments a fit for people trying to stay well and balance their life and trying to be aware of all these things going on? How does that a fit?
Well, first, I always think chiropractic's a fit with everybody. Almost, you got to put that in there because you always get the one person that doesn't respond or for whatever reasons. And the reason I say I think chiropractic is a fit for every season and every time of year, and the founder and developer spoke about that because you can't control the external environment. Other practices talk about that too. Disciplines, which is very true. We can't control the outer environment, so why waste time doing that? Just make yourself balanced and healthy, and then every season will come. I'm not saying don't take the opportunities that the seasons answer. I think every day answers something. I just think sometimes we focus more things like the new moon and the full moon. It's not a comparison, in my opinion. You know, one's better, one's worse. I think they're both opportunities to enhance your life and your well-being and your understanding, just like every change of the season. No matter which culture you follow and which protocols you use for change of the season, I think just a simple awareness of the change of season. Look at the American Indians. Who knew better than them? But they got squashed, right? Let's be realistic. They're not around, So some people say, oh, they're not around because it wasn't powerful enough. I don't think that's true. I think anybody who teaches you to be one with nature and connected and peaceful and calm, you can't stop that, no matter how many times people try. Peace, love, and just an awareness is just part of just a more peaceful world. I don't mean that in an unrealistic way. I'm talking about just overall general. You want to be nice. You cross the street and somebody doesn't beep the horn and yell at you because 2 seconds, of their life you took. You know what I'm saying?
Yeah,
So
happens all the time. Yeah.
yeah, so things like that. Like, I mean, I think there's just so many messages throughout our day on life and what we're doing in our lives, because everything that happens to us in life is our interpretation of it. You could be sitting next to two people in the same exact food. One loves it, the other doesn't like it. And then we get into that comparison mode, better, worse, good. I think all those things just distract us from who we are and who we want to be. And I don't mean that in a selfish way. You got to be strong of who you are and be comfortable with that, no matter who it is or what it is, and share that with people. Let people know where you're coming from. And if they don't agree with you, that's okay. Just don't bother with them. But I think as we age, we should just cut out. And I think the earlier in life you do it, the better off. Anything that impedes our flow from happiness and feeling good. What's the sense? If you're one of those people who believe you should suffer and all that, then go suffer. But that's not my goal. I don't think that's what we're put here for.
What's very interesting to me in listening to you describe this philosophy, your outlook on treating people and life, I would guess that many new patients or maybe somebody who's thinking about, wow, I don't feel great and I would like someone to help me feel better. And they're considering coming to New Jersey Total Health and seeing you, they don't realize that it's not just chiropractic care or not just, hey, I might be interested in, say, rapid release or some treatment, but you have a very philosophic, very mental outlook on things. It's a huge part of how you help people. And I think people don't understand that. Do you find that people are surprised by that? They may call you and say, well, I want a back adjustment or I think I need this. But then they find out that you have kind of a more broad outlook on things. Are people surprised by that?
Yes, I feel it, and it's a good example for other things in life. Once we hear something, chiropractor, doctor, mother, father, sister, but we attach our beliefs to it. So, based on your life experience. So when people hear chiropractor, they think of all the other chiropractors that they've been to and the things that they did, and it's all good, I believe, but it's so different than what I do. So to try to explain that to everybody and to get them to understand is very tough. And I got to be honest with you, sometimes I lose my patience. They don't want to be bothered. The person don't trust me, go somewhere else. I know that sounds crude, but come on. It's like, I'm not here to hurt you. And if you want to do a free consultation, I always offer that. So let's just see if we're a match. You'll know what I'm doing. I'll know what you want. And if we're a fit, we're a fit. If not, then that's fine. I think it's better off you go somewhere where you're comfortable. That's why I always offer a free 10 or 15-minute consultation, either on the phone or in person. I like in
Yeah.
person.
So if somebody's thinking about, wow, either they don't feel well or they're very curious about what you're talking about, that's the next step. How does somebody do that? I mean, very practically. I don't mean in a salesy way. I mean, is it best to call you? Do they just go make an appointment online? Like what's the easiest way to do it?
Well, if I'm around the office, the call's the best. If Janice is in, email's okay. But either one, but I prefer the call.
But what happens, right? So, hey, I'm looking for Dr. Vinny. Like, explain.
Well, first, I always ask the person, take 5 or 10 minutes before you call me. Think about what you read, see how you feel, sit with yourself for a few minutes, and then see if you still want to call.
Hmm.
Sometimes people say, you know what? I don't think he's going to be for me. There's a little more out there than we realize leading to our decisions. So I say, just take a few minutes to yourself. Don't worry about me. You might got to feel comfortable, even from the start, right, with the call. Call up with some specific questions, and if, Janice can answer them, she'll tell you. If not, we'll set some time where I'll talk to you. So that's what I say to people. Think about it. Be really sure you want to call, and then call. Ask. Do I need to set up an appointment? I have one specific question. Can you answer that now, or should I call back? And then Janice will tell me if she's there. If not, I'll listen to the message if I don't pick it up, and they'll make the decision from that. So the person always knows what's going on. They're going to know if they're going to come in for a 10 or 15 minutes consultation. They're going to do it over the phone, or if I could help them or not. If I can't help somebody, I tell them 1, 2, 3. I just think. That's most doctors would do that, and then there's other times, Brian, too, you have to realize, I explain this to people sometimes. I can't tell you in one visit. You got to do a few to get a read from your body and to see what's going on. Not everybody, but most people, because as you progress, things change. Sometimes I get difficult cases where I'm questionable myself. And I tell the patient, I say, listen, I'm not sure, but if you're willing to try, give me a few visits and see how you progress from there. And then we reevaluate after that, and then we either continue or don't. So, it's an ongoing, need to know basis kind of thing. Like each visit's different than the next. Some things are similar, don't get me wrong, but the approach is always based on where you're at when you come in, not when I first saw you.